Depression is a condition that affects a person's mood for more than 2 weeks straight. It's quite common, with about 8.7% of people aged 18 to 25 experiencing it in the US alone. Worldwide, around 264 million people suffer from depression. Symptoms include feeling sad, worthless, or guilty, changes in appetite, sleep problems, fatigue, loss of interest, slow movements, difficulty thinking, and even suicidal thoughts. Depression can impact daily life, making it hard to work or study, and sadly, it can lead to suicide, causing over 700,000 deaths each year. There are different types of depression, such as major depressive disorder, bipolar disorder, persistent depressive disorder, and seasonal affective disorder. The exact causes can be complex, involving factors like inflammation in the brain, genetic influences, life experiences like abuse or loss, and changes in brain chemicals called neurotransmitters. Treatment for depression often involves antidepressant medications, but they may not work for everyone, and some people worry about their addictive effects. As a result, some patients turn to complementary and alternative medicine, like dietary supplements, as an additional approach to help with depression symptoms. Dietary supplements are products taken by mouth, such as vitamins, herbs, minerals, and probiotics, to complement regular diets. Some studies have shown that certain dietary supplements, like prebiotics, polyunsaturated fatty acids, PUFAs, vitamin D, B12, magnesium, zinc, and curcumin, may have positive effects in reducing depression symptoms. For instance, prebiotic use has been linked to decreased depression scores, and vitamin D and PUFAs may have complementary benefits on depressive symptoms, anxiety, and pain. This review summarizes the latest clinical studies on dietary supplements, exploring their types, dosages, and effectiveness in reducing symptoms of depression. By studying these supplements, we hope to find additional ways to support people dealing with depression and improve their well-being. In conclusion, after studying various clinical research on using dietary supplements to treat depression, we found that some supplements are more commonly used than others. The most common ones are PUFA, polyunsaturated fatty acids, with a combination of EPA and DHA, followed by vitamin D and probiotics. For PUFA, a daily dosage of 0.7 to 2 grams of EPA and 0.4 to 0.8 grams of DHA for 3 weeks to 4 months seemed to have a positive effect. For vitamin D, a dosage of 2,000 IU per day to 50,000 IU per week for 8 weeks to 24 months of supplementation was found beneficial. Additionally, certain types of probiotics, specifically lactobacillus and bifidobacterium, in doses above 108 CFU, colony-forming units, found in yogurt, capsules, or sachets, showed beneficial effects in depression treatment. Using a depression scale to assess the effectiveness of the intervention was valuable in determining how well the supplements worked. Based on the evidence, we suggest that PUFA, vitamin D, and probiotics should be considered as beneficial dietary supplements in managing and treating depression. However, it's important to remember that individual responses to supplements may vary, and it's always best to consult with a healthcare professional before starting any supplementation regimen. By incorporating these dietary supplements into depression treatment plans, we hope to provide additional support and improve the overall well-being of individuals struggling with depression. At the conclusion of this video, we've provided a brief overview of the research on dietary supplementations and depression. For a more in-depth exploration and access to the complete study, be sure to check the references below. Knowledge is power, and we've got you covered. Dive deeper for a comprehensive understanding. Thanks for watching.